So I'm Jason Wolf, president of the Beryl Institute. The Beryl Institute, we're a global community of practice on creating improvement in the patient experience through shared knowledge and collaboration. And we've really built, I think, a global community of individuals across segments of the healthcare practice to engage in discussions on what it means to improve the healthcare environment for those both receiving and delivering care. Done it through really the building of educational materials, resources, thought leadership, webinars to white papers, research and elsewhere, and also bringing people together just in communication and networking to learn from and share with one another. So patient experience is the sum of all interactions shaped by an organization's culture that influence patient perceptions across the continuum of care. And those four aspects of the definition, the idea that interactions, that it's based on interactions, that it's grounded in culture, that it happens at all touch points across the continuum and really also in the spaces in between, and that it is ultimately the perceptions of patients, families, their support networks that are our indicator of success and experience are all, I think, critical elements. So while it's a simple phrase, there's a great deal of complexity involved in it, but it does bring us back to the fact that in healthcare we're a business of human beings caring for human beings. And so if we can't get the interaction part right, be it a personal interaction or a clinical interaction, we can really never deliver on our experience promise. And the kind of organizations that we build, so that's really what I think we mean by culture, are the means by which we deliver all of those interactions. And so we have to get all those elements right. It's not simply just getting our checklists right or our clinical protocols correct, but it's really building a systemic solution that drives lasting and sustained outcomes and the positive experience for everyone involved in the healthcare encounter. You know, the barriers to, I think, experience excellence are interesting. I mean, and we can go to what the data says, which people will always say, well, it's time, or it's, leadership isn't focused, or there's too many priorities. I really think that probably the biggest barrier right now is people are still trying to get their arms around what it is. And I think all too often we have tried to over-apply tactics to what really is a systemic issue. So I believe that probably one of the bigger barriers to truly providing the most positive experience, the idea of engaging people from patients and families, to having patient-centric principles, to thinking about what patient activation, all the terminology that we use, we've separated all these pieces and instead not really thought about the systemic solution. That as a human being in healthcare delivering, delivering care to human beings, what is that experience we believe people deserve? And so I think stepping back to what that broader conversation on what experience can be is one of the greatest means by which we can actually overcome that barrier, because I do think we get stuck in the mechanisms of healthcare all too often, the system that we created to deliver on process and not really thought about the broader strategic impact that we hope to have. So it might be a high level from the standpoint of your question, but I do think that does get in our way of our capacity to ultimately provide the best in experience. I think technology is a key lever. I mean, to me, it's one of the strategic filters of experience, and technology in a number of ways. It's the means by which we now communicate with people. It's the means by which we now share information. It's the means by which we can create more efficient and expedient processes. I think we would be remiss if we didn't understand that there's a technology aspect to providing better experience and better outcomes. But it's not technology for technology's sake. And I think, back to the previous discussion we were having around a systemic solution. When we begin to think about, building an experience that really impacts people, it's the core ideas of the definition, but it's then the resources that you put in place to ensure the best in experience. So if we realize technology is a tool in our tool bag in terms of ensuring that we can elevate experience and we use it in that way with the right strategic lens, and I think it does have a significant impact. But the application of technology for technology's sake, I think we've seen that not necessarily work to our advantage and sometimes even become a burden on people's capacity to ultimately provide experience as well. Really where healthcare is going, I think, is to this idea of a commitment to the human experience of balancing the patient and family outcomes with ensuring a good caregiver, provider experience, creating healthy folks and delivering care ultimately ensures, I think, better outcomes for those that healthcare delivers care for, but they have to do that in partnership. So I think the ability to engage in where healthcare is going to be centered on this idea of partnership, of co-design and co-production, of engaging all voices in not only the creation of solutions, but in the next steps forward in terms of designing what healthcare can and should be. And I think healthcare's got to challenge it itself a bit. We have, I would even be so bold to say, I think the word patient and the phrase patient-centric and patient-centricity is actually a provider-centric language. We are saying that we believe from healthcare, patients should be at the center. And I had a very, I think, wise patient I was speaking when I was in Australia that said, nobody asked me if I wanted to be in the center. Do we really always want to be there? And not dissimilar to, I think, the evolution that we've heard in healthcare around, doing 2 patients to doing 4 patients to doing with patients. We can't see everything as linear in that way. In fact, there are moments, I think, where as patients and family members, we want things that we know things are going to be done to us or for us, not always with us. And so we have to find, I think, that ability to balance between those things and create the right kind of conversations that we are able to co-create the future of healthcare. I think the role of the Beryl Institute has to serve as a neutral ground for this conversation, so to push the boundaries of the discussion, to help elevate the thinking and create a safe space for people to share the greatest ideas and really almost, circle around failures and find means for improvement. And so, my hope is that we continue to push the experience story, not as a nice thing that healthcare has to do, but, we've always said, we believe if you think about healthcare from an integrated perspective, if you think about experience then from an integrated perspective, that it is about quality, it is about safety, it is about service, it's about cost, it's about access. So for us, it really is continuing to elevate that integrated perspective, that all that we do in healthcare ultimately contributes to the experience people have, that in fact, whether we plan for it or not, people are having an experience in healthcare today. And it behooves us, it really calls on healthcare leaders to realize they can create that experience or just leave it to chance. So for us to kind of instill a sense of strategic imperative, that this isn't about satisfaction, it's not about making people happy, but it's about driving the outcomes that we believe healthcare is capable of and that the people that are experiencing healthcare deserve. I think that will continue to be our rallying cry. I think that's the opportunity we have, and I think the conversation we have to stay in together in terms of driving, I think, the right kind of outcomes for healthcare today and well into the future. It's interesting. Empathy to me, I think, we did a research on empathy, compassion, all these kind of things. We actually asked consumers to what extent was empathy and compassion important to them. And I was actually surprised. It came down the list. And I think it's because, again, empathy is a healthcare-centric language, right? A typical patient or family member out there knows what they want to see. They want to feel listened to. They want to feel like they're being spoken with in a way they understand. Those were the things they elevated in terms of importance. So, for me, the lens is not to get stuck in what empathy is in so much, so not to push back at the question, but to think about what does it look like in action. I'm probably less concerned about how we define empathy and elevate empathy, and really about the actions we take to ensure that patients and family members and those that are delivering care feel heard, that are communicated to effectively, are engaged in ways that matter to them. Then I think they feel what we believe empathy is, all of those things, without having to put a label on it in a way that is about us doing something, but more so about engaging the folks in care themselves. So I think we do actually amplify empathy. We do elevate the delivery of compassion by moving beyond the words to the actions, and to ensuring that we engage people in those ways, that they feel as if they're experiencing the things that matter to them, not words that we think equate to that. It's important that people know, the Beryl Institute is a name, and we've been very clear it's not, and it never has and it'll never be about the Beryl Institute, it'll never be about Jason Wolf. It's about the conversation and the community that we bring together. It's about this work that you're doing right here. To me, the honor is to be able to sit here and share my story, to be invited to participate in a way that I think we're changing healthcare. So this is where the impact occurs, right? It's somebody like you standing up and saying, if we share voices in a way that are open, honest, real, rich, and committed, and aligned around what we believe is possible in healthcare, then we can do incredible things. That's why I believe we exist in our organization. Back to your first question, we're a community of practice. Our job is to catalyze and get out of the way and ensure that conversations like this can thrive. And so, I can say we're committed to elevating your discussion as well, and I think anybody that's thinking about contributing to this kind of dialogue and elevating their own contribution to healthcare, really, that needs to happen.